Dogs, man's best friend. In many ways, they are very similar to us. For example, we both have health issues and dental problems. At first, we were planning on exploring caries in dogs, but as it turns out, caries are not much of a problem. When we look at the morphology of a dog's teeth compared to a human's, they are sharp and have little fissures and pits. This, alongside a high-protein, meaty diet, makes it difficult for plaque to build up and caries to form. Instead, we've decided on a much hotter topic in veterinary dentistry: Lingually Displaced Mandibular Canines, LDMC. To put it simply, it's when the lower canine is abnormally positioned towards the center of the mouth. LDMC can be found in Italian Spignon, miniature Schnauzer, and is especially prevalent in Cockapoos. It can be caused by abnormal skeletal growth, malpositioned individual tooth, or both. Abnormal skeletal growth plays a major role in LDMC for Cockapoos, which is a cross between Cocker Spaniel and Poodles. Cocker Spaniels have big and broad snouts, while Poodles have very narrow ones. This leads to a common problem in Cockapoos called mandibula augusta, meaning narrow lower jaw. This leaves no space for the lower canines to grow outwards, resulting in the lower canines staying behind the upper canines and striking the roof of their mouth. If the roof of the mouth is penetrated and damage is done to the tissue, it can result in inflammation, or worst case scenario, cause a hole in the nasal cavity where infection and inflammation can run rampant. LDMC also prevents mandibular growth and crowds the erupting adult dentition, increasing the chances of trapped food debris, causing gum problems and caries. Although the problem is very complex, we shouldn't just wait and see like most do, but try to manage it early on. Now, you may be wondering what some of the possible treatments are. Well, don't worry, we've got a wrap just for you. This is reality. Do you see these teeth? Lingually displaced, it just hurts to speak, this is reality. You see your dog in pain, suffering, begging you, nothing to gain, you're feeling stressed. Looking like a mess, you hurry up and drive, meet up with a vet. She tells you come on in, don't worry, don't fret. Let me show you all the options for your pet. Extraction is the first one here. We take out the tooth and we deal with it there. Your dog will have instant pain relief, and the cost of the treatment isn't very heavy. But however, I simply must admit, the lack of a canine doesn't look very lit. There's also a chance it gets very shy. All the constant checks makes it nervous, my guy. Coronectomy. Here is the gist. Removal of the crown is what it consists. While you're at it, the pulp's taken away. The removal of the pulp takes away the pain. Compared to extractions, it looks a lot better. The constant checks dogs better than ever. The problem is that it's very expensive, and at a very young age it goes to anesthetic. Finally, we got the ball therapy. The dog chews a ball and it moves the teeth back in place. It is definitely cheap and it's painless, so you don't have to weep. A problem rises. Has a very set time. The baby teeth are fully grown, they are not fine. This method is used when the teeth are about the early stages of an adult teeth that's come out. Yeah.